Most people think that their atrial fibrillation is well controlled simply because their heart rate, when they check it on a blood pressure monitor, looks okay. But good control is much more than just a number. And getting this wrong is one of the reasons I'm starting to see more patients develop heart failure. Following on from what we've previously talked about, many of the patients I see in hospital with heart failure have had atrial fibrillation for maybe months, sometimes years. And when you look back, their heart rate may have been acceptable at times, but their atrial fibrillation wasn't truly well controlled. They were still fatigued, still breathless, especially on exertion, still gradually losing exercise capacity. And that's the key point. Control isn't just what we see in a snapshot. It's what's happening to the patient over time. So what actually defines good control in atrial fibrillation? The first layer is rate control, keeping the heart from running too fast. Resting heart rate generally should be less than 80 beats per minute and might need to be stricter in symptomatic patients. An acceptable lenient control might look like less than 110 based on race 2 trial. But here's the nuance. It's not just the resting heart rate that matters. What really matters is what happens when the patient is doing their normal activities, walking, climbing stairs, living their life. We might see this better with a Holter monitor for 24 hours or telemetry in hospital and having the patient walk around the ward. If the heart rate is surging with minimal exertion, like barely moving out of bed, that's not good control, even if the resting numbers look fine. The second layer is rhythm control, trying to restore or maintain normal rhythm. This is particularly important in patients who are symptomatic, have reduced heart function, or are developing signs of heart failure. Early rhythm control improves outcomes, and this was seen in East AFNet for trial. And in some patients, especially those with declining heart function, then restoring rhythm can actually improve or even reverse the heart failure. But perhaps the most important concept is this. Good control is not defined by a single number alone. It's defined by more data and how the patient is functioning. Are they maintaining their exercise tolerance? Are they free of significant breathlessness? Are they able to live a normal life? If the answer is no, then regardless of what the ECG or the monitor says, that atrial fibrillation is not well controlled. So what should raise concern? Well, gradual decline in exercise capacity, increasing fatigue, breathlessness or dizziness on exertion, recurrent hospital presentations, evidence of fluid retention. These are all signals that the heart may be under strain. So if you take one thing away from this, don't judge atrial fibrillation control by a single heart rate reading. Ask a better question. Is the heart coping? And is the patient thriving? Because what I'm seeing more and more is that when we rely on numbers alone, we miss the early signs of decline. And that's when atrial fibrillation could be quietly progressing into heart failure. And it's an opportunity to intervene and stop that whole roller coaster.